In this video, I will explain to you what you can do for temporary while you're waiting for your implant to heal. So by now you understand when you place an implant in the bone, you have to wait about 4 months before you can load the implant with a crown. However, if you're putting an implant on the back, a lot of people aren't concerned about it. You place the implant in, you wait for it to heal, and then we load it with a crown. Some people, however, when they're waiting for the crown, for the implant to heal, they're missing a tooth in the front, and it's a highly aesthetic area and want to have it temporary. And there's really kind of 4 things you can do. The first thing, of course, is just nothing and have a space there. And for some people, they're very comfortable with that, and we're okay with that. Other people prefer to have that space filled. So from there's 3 options if you want to have the space filled. One option is to do what's called like a partial denture. It has many names. A denture with 1 tooth, even though this one has 2, just using it for explanatory purposes, one of the ones are a front tooth. You can do a denture with 1 tooth. It's called a partial denture with 1 tooth. It's called a flipper. It's all the same thing. It's basically a piece of plastic with a plastic tooth. It goes on, it sticks in there, and you pop it off. It's very convenient. However, it's difficult to eat with, but it does a nice trick of having a tooth in there. So that's one option. A second option is to make what's called an Invisicryl with a tooth, an SX retainer with a tooth, a suck down with a tooth. It's all different words for the same thing. It's like a clear plastic aligner that fits perfectly over your teeth with a fake tooth in it. So if you're missing a tooth like this, on the 1 tooth, it goes over and it snaps in over your teeth. And when it does, and you're wearing it, it's very clear so no one notices you have it on and you have a tooth in there. This works really well. Again, however, in these 2 options, they have to come off when you eat for all intents and purposes, and you have to be very careful. People leave them in napkins, they get swept away and lose them, so you do have to be careful. Now there is a third option, what's called immediate loading or immediate temporary crown, and that's like a tooth in the day where you come in, have the implant, and we actually screw a temporary crown into the implant. This is not always possible, so I don't like to get people's hopes up, but if it is possible, it does add a significant extra charge. But what we would do the same day we place the implant, we would actually put a temporary crown that looks like a real tooth and screw it into the implant, and we would leave it in there for the 4 months it takes. So in this video, I explained to you the 4 different things you can do if you're missing a space, which is to leave it alone, use like a 1 tooth partial denture called a flipper or 1 tooth denture, to use a suck down clear aligner with a fake tooth in it, or if you're a candidate, to actually use a temporary implant crown.